I'm going to talk about dental implants and their role in replacing one or more missing teeth. So what is a dental implant? Well, if we look at a dental implant, it's made up of three components. You've got the titanium implant, which is actually placed into the bone. You've got an abutment that actually replaces the dentine or the inside of the tooth, and you've got a porcelain crown that replaces the tooth enamel. The good thing about a dental implant is that the componentry is actually under the gum. So when you look at a dental implant in the mouth, it actually looks like a natural tooth. So who would benefit from this treatment? Anyone that's missing teeth, and I suppose front teeth is always a problem. If you're missing front teeth due to trauma, this patient has had a football accident and lost their front teeth, is that they will normally have a plate, and a plate will usually have wires, always made out of plastic here, and the wires are there to hold the plate in place. So if you look at what it looks like in the mouth, is that you can see these wires, and you can also see the difference in the color of the teeth. Sometimes chrome plates are made, but again, they still have the wires, and chrome plates tend to fit better, but again, they are removable and have to be taken out every night. Back teeth are a bit more of an issue because when people lose back teeth, of course they can't chew. If they can't chew on this side of the mouth, they're going to then start chewing more on the other side, and naturally that will wear down or break the teeth on the other side. The other problem we have is that teeth move. So if a tooth is taken out, and this is a tooth that was taken out probably about 25 years ago, is that you can see how the top tooth is starting to drop down or drop out, and you can actually see how the back teeth are starting to actually tilt in. So what are the disadvantages and advantages of this treatment? One of the disadvantages is the cost. Because it is expensive treatment, we're talking about anywhere between $5,000 to $6,500 per tooth. We can't do this on all patients. If the tooth has been lost for a long time and there's been a lot of gum and bone shrinkage, is there may not be enough bone to place implants. So we need good quality and good quantity of bone to place implants in. There is always possible complications with any surgery, and this must be considered if you're actually thinking of this treatment. The main advantages is that it's a fixed solution, so it's not removable, so it's not like a plate or a denture. You can of course chew and smile with confidence. Also, we know that a plate tends to change or alter the taste in the mouth, so therefore this feeling like a natural tooth again, you're able to actually taste food better. The appearance is exactly the same as a natural tooth. Longevity of implants is we know that an implant will last the rest of the patient's life. The crown on top will last anywhere between 15 to 20 years. Let's look at a case. One of the most difficult cases is a missing front tooth because not only do you need to get the function back, the appearance is critical, and they're probably the hardest cases to actually work on. We've got Natalie who's come in and she said that her front tooth is feeling a bit loose. It was knocked before, it's had root canal treatment. If we look at the tooth, you can see that it's a bit dark at the top of the gum there. But what's happened is there's a gap, and the gap is starting to allow a lot of bacteria saliva to actually start to seep into the tooth. And the tooth is so loose because the crown is about to fall off, and the crown eventually did fall off, and you can see this was the state of the tooth underneath that crown. We couldn't save this because there's nothing for us to actually build up on. So this root had to come out. She also mentioned that she didn't like the appearance of her other teeth, so we're going to do some porcelain veneers on the other teeth to basically get a better appearance and better cosmetics. I'm not going to show you photos of treatment day because on treatment day we took that root out, we placed the implant in at the same time, and we placed a temporary bridge over the top. We know that implants take around about 3 months to integrate into the body, so what happens over that time is the bone actually grows into the implant, and that then is fixed. So this is a few days after treatment. You can see the temporary is now in place, and she can smile of course with these temporaries. And then after a 2 to 3 month period, we change this to individual porcelain crown or implant crown over the implant, and we've got 3 veneers. If you look at a smile photo here of Nellie, you can see we've restored her smile back. So dental implants are an excellent solution for those patients that are missing 1 or more teeth. They are a fixed solution, and they're very long-lasting treatment. So please feel free to give us a ring on 1-800-SMILING, or you can always send me an email at adriancat@mac.com. I look forward to seeing you in our practice.